Hello and welcome to another audio podcast. In this series, in this audio podcast series, in around the LabZtorm effect v.3. This is a storm lobostic soliloquy and an audio podcast in around the role of endogenous opioids in ischaemic preconditioning or IPC in humans. This is an audio podcast aligned to another Storm Lobostics production. In this audio podcast, there will be a sort of an overview in and around a remote ischemic preconditioning or RIPC. So in patients or recipients with severe sort of multivessel coronary disease, the cardiac muscle is more commonly revascularized using particular surgical intervention or surgical techniques. The procedure can be complicated by perioperative myocardial injury, which can result from acute myocardial ischemic-reperfusion injury when going on to and coming off cardiopulmonary bypass, for example. And so, owing to an aging population, the growing prevalence of comorbidities, patients or recipients undergoing sort of the surgical techniques or interventions can be at higher risk. Can be at higher risk. At higher risk of perioperative myocardial injury. More so sort of than has been highlighted in literature sort of retrospectively. The extent of pericardial perioperative myocardial injury is a critical determinant of clinical outcomes, sort of post surgical intervention. So specifically now in and around remote ischemic preconditioning or RIPC, a more amenable and less invasive approach to cardioprotection can be achieved through whereby a brief ischemia in one region of the organ protects distant tissue or organs from a sustained episode of ischemia. The mechanistics in and around this surround what has been referred to in literature, sort of what has been referred in literature over the past two or three sort of decades, has been referred to as remote ischemic preconditioning or RIPC. Works by Prisklenk or Pryclenk in 1993 demonstrated, for example, in a canine model of RIPC as an intra-organ mechanism, showing that or highlighting that repeated brief circumflex artery occlusion reduced infarction in an area of the myocardium that had not been subjected to the preconditioning stimulus. The implied cardioprotection. This implied that a cardioprotection stimulus could be and can be generated in a remote location from the site of index ischemia. This cardioprotection phenomenon was later observed in non-cardiac tissue also such as, for example, in and around the renal or kidneys, the small intestine, and skeletal muscle. Pioneering work pioneering works from Carbunda, Carbunda and team in 2002 tested the hypothesis that limb ischemia induces remote preconditioning, and reduces endothelial or IR injury in humans, and reduces experimental myocardial infarct size through a variety of in vivo investigations. And so the team highlighted and demonstrated that RIPC prevents IR endothelial dysfunction in humans, and reduces the extent of myocardial infarct size in investigational or in investigation laboratory or experimental in experimental models. Now there's works by Giorgio Kakis, and team in 2005 also sort of demonstrated that remote ischemic preconditioning, or RIPC, in humans has two phases of protection against endothelial ischemia-reperfusion, and both of which are intriguingly neuronally mediated. RIPC can result in a delayed protection between 24 and 72 hours later, similar to that of delayed ischemic preconditioning, or IPC, because of local stimuli. Now, there's works by Walsh and colleagues in 2007 had highlighted in 82 recipients undergoing elective open abdominal aortic aneurysm repair, who were randomized to receive remote ischemic preconditioning or not. The remote ischemic preconditioning, or RIPC, protocol or procedure involved a sort of clamping on each common iliac artery for 10 minutes, followed by 10 minutes reperfusion. The results demonstrated clinical benefit or advantage in favor of a remote ischemic preconditioning protocol. The technique could potentially reduce. The technique had been documented to inform that it could potentially produce perioperative myocardial injury and consequently other tissues. It was works by Schmitz and team in 2007 who implemented and used a porcine model to demonstrate protection using brief intermittent limb ischemia. The team used 4 cycles of 5-minute alternate reperfusion applied to a limb during 40 minutes of occlusion of left anterior descending artery. The reduced myocardial infarct size and this reduced myocardial infarct size and protected against abnormal cardiac output or arrhythmias during the myocardial infarct reperfusion phase. The late phase of PC induced protection against infarction is prolonged and lasts up to 72 hours, and this has been termed as remote late conditioning, and remote late conditioning also allows protection against other endpoints of ischemia-reperfusion injury, including induced ventricular arrhythmias, and experimental modes involve administration of pharmacological agents, and some pharmaceutics have included, for example, adenine receptor antagonists, nitric oxide, and donor compounds, and also prostacyclin derivatives. And so at least 24 hours to 72 hours before an IR protocol or procedure. Experimental investigatory models also have involved the administration of pharmacological agents, sort of more prospectively, and remote conditioning is relatively, has been documented as relatively safe and might circumvent the issues and sort of problems of feasibility and in around sort of studies where they have shown, where there has been evidence with sort of a great potential in the applicability of remote ischemic preconditioning in a clinical setting. So obtaining a better understanding of the mechanisms or mechanistics in and around the transfer of protection might enable full exploitation of this form of protection. In appreciating the general RIPC concept and its potential application in humans, the post-conditioning concept, or POC concept, originally defined by Zhao and colleagues in 2003, has advanced, and the investigations and literature suggests that reperfusion injury contributes to a far greater extent that had been previously documented and or accepted. So this now draws the end the close of this the end and the close of this particular audio podcast in and around remote ischemic preconditioning. In this audio podcast series in and around the LabZtorm effect v.3. This has been another Storm Robotics soliloquy and another on this audio podcast surrounding the role of endogenous opioids in ischemic preconditioning or IPC in humans. And once again, this has been another Storm Robotics production. The next audio podcast will look into and delve into ischemic post conditioning. Thank you for tuning in.